Hello, and welcome to Lesson 2, dedicated to key clinical processes in lifestyle medicine. In this lesson, we will describe screening and diagnostic tests relevant to lifestyle-related disease. We will talk about components of the patient's history and physical with an emphasis on lifestyle risk factors. And also, we will describe how to interpret the tests using evidence-based national guidelines. So what are the screening and diagnostic tests relevant to lifestyle-related disease? First thing is, of course, asking the patient about his smoking habits. Smoking status should be assessed for every patient over 10 years of age, ideally at each consultation. Those who are identified as current smokers should have the current level of nicotine dependence assessed. And also, if you have some intervention in hand, you should use them as you get these answers. What about nutrition? So nutrition is something that comes up with every, I would say in my clinic, almost every second visit. But here the recommendation are to ask the patient about his nutrition habits every 2 years. Patients should be asked about numbers of portions of fruit and vegetables and about the food quality. And if they drink a soda drinks, what kind of fat they eat, and more information about the nutrition, and of course, suggesting healthy nutrition should be followed. What about overweight and obesity? So every 2 years, the BMI, the body mass index, should be calculated, and also the adult waist circumference. And those who looks in overweight should be even be measured every year or so, and followed by suggestions to help them change or lose weight. Alcohol, every 3 to 4 years, patients should be asked about the quality, quantity, frequency of alcohol intake. And you should start that from age 15 and up, and even in some places, you should start that even younger, because it's very important. We are actually missing a lot of alcohol, and this is something that you should emphasize, because it's one of the causes for death in the Western country. Physical activity, I usually ask about physical activity more often than every 2 years, but this is the recommendation. And you should ask what kind of activity they do, how frequent, and what is the level, and what does it work for them, doesn't work for them, and of course follow up the recommendation of 150 minutes per week of activity. So this is more or less something that is like a screening about lifestyle related behaviors. Some more screening tests relevant to lifestyle related disease should be screening for high blood pressure. Measuring blood pressure, the frequency differs from every 3 to 5 years in the younger age, and above age 40, every year you should measure a blood pressure. Of course, we need to screen for abnormal blood glucose and type 2 diabetes mellitus. So frequency is also related to age and other risk factors for non-communicable disease. Glucose abnormalities can be detected by measuring the blood glucose, by measuring hemoglobin A1C, or by oral glucose tolerance test, whatever suits you and suits your clinic. Also, we should screen for lipid profile, and this is between 3 to 5 years before age 40 and above age 40 in variable frequencies. It depends on the recommendation in your country, but usually recommendation says between 1 to 3 years to screen for lipid profile. So what are the components we should look for when we have a patient coming into our office and decide to do a lifestyle risk factor assessment? As we mentioned before, we should ask him about his smoking habits, addiction, not just alcohol, but every kind of addiction should be asked. How he eats, what kind of medication does he take related to non-communicable disease, to cardiovascular disease, what is his family history? This is very important. We know that cardiovascular disease, diabetes mellitus, hypertension are all like running the family. So we should know what kind of family history does he have. And obviously, in some places where it's where you can ask this. You should ask about sexual activity and sleeping habits as well. What about physical examination? So overweight and obesity, as we mentioned before, we should measure a BMI every year or two. We should measure blood pressure. We should listen to heart and lungs to see if there is like any signs of NCDs and maybe peripheral pulses and this kind of physical that we need to know to assess lifestyle risk factors. So make sure you are familiar with the recommendations because they change from time to time. And this is just a few examples of national recommendations for different lifestyle related measurements. Like we can look in the internet and find out what are the latest recommendation about blood pressure, like the report from the JNC8, which is now the last, but maybe in 2 years' time, there will be different recommendation. We have from the US Preventive Services Task Force recommendation about different things, about weight management, about diabetes mellitus, about lipid, about blood pressure. So you should screen, you should look at the internet and see what are the latest. And in some countries, they have it like national guidelines of how to interpret and what are the measures we are looking and how often should we take them and so on. So make sure you are familiar with the latest guidelines in your country and react appropriately. The family physician or medical specialist role include assessing person health status and risk factors. As we discussed in our first lesson, it is important to work as a team to promote lifestyle. So the patient will benefit from collaborating with other health professionals, including nurses, physician's assistant, psychologists, dietitians, exercise professionals, health coaches. There's so many people that can help us in promoting lifestyle in our clinics. So make sure you are all working together. This is the end of lesson 2. So please take your quiz and I'm sure I'm here. I'm sure you'll make it. And if you need some more information, read in the materials of this lesson. And I'm here ready to start lesson number 3. Thank you.